Hello everyone, starting with today's lecture. In today's lecture, we are going to discuss the miasms, that is, psychosis and syphilis. Prior starting the miasms, psychosis, and syphilis, first we will revise what we studied in previous class. In previous class, we started with miasms. In this, we studied about the term miasm means it is a noxious influence, and it is also defined as a person's inherited disease group. Every human has an inherited miasm with inherited responses that has been passed from one generation to the next generation. So it is the word meaning of miasm. But Dr. Hahnemann put forth the definition of miasm as the miasms refers to the dynamic disease producing power which stains and pollutes the human organism with unhealthy tendencies and thus becomes the producer of different type of diseases. So this is the main definition of miasm. Then we classified the miasm into two types, that is acute miasm and chronic miasm. So in this acute miasm is a dynamic disease producing power which causes acute specific infectious epidemic disease having almost fixed manifestation. And according to Master Kent, an acute miasm is one that comes upon the economy, passes through its regular prodromal period, longer or shorter, has its period of progress and period of decline, which there is tendency to recovery. So this is the acute miasm. So then again classified the acute miasm into two types, that is recurring type and non-recurring type. So in this, the recurring type means those type of acute miasm that recur in the same manner more than once in lifetime of a particular person, that we call it as a recurring type, and having the examples like dengue, chikungunya, swine flu, cholera, plague, etc. And the second type of acute miasm is non-recurring, or also called it as a fixed acute miasm, and this is also called as a fixed miasm. This type of acute miasm are those which attack a person only once in lifetime, and in this the examples are, that is, smallpox, chickenpox, whooping cough, etc. So these are the two types of acute miasm. So along with these two types of acute miasm, there are some special types of miasm, that is half spiritual miasm and half acute miasm. So in this, the half spiritual miasm, in the book Chronic Diseases, Dr. Hahnemann explained miasm of measles, scarlet fever and pox, etc., called as half spiritual miasm because of after completing their parasitical existence in the system for some period they die out, leaving the organism to recover soon if the patient does not die by the time. And the peculiar characteristic of the half spiritual miasm is that after they have penetrated the viral force in the first moment of contagion, they produce the disease in their own way. Then the parasites quickly grow within it and usually develop a peculiar fever after producing a mixture of a cutaneous eruptions, which in turn is capable of producing its miasm. And finally they die, leaving the organism free to recovery. So this is the half spiritual miasm. And the second special type of miasm, that is half acute miasm. This miasm also called as a miasm hydrophobia, that is having a fear of water, and has been termed as a half acute miasm. The miasm takes effect of moment a person gets beaten by a mad dog, and the poison of this miasm gets communicated to the nearest nerves. As soon as the malady develops inside the organism, the madness breaks out as the acute, quickly fatal disease. So this is the half acute miasm. Then we started with the second type of miasm, that is chronic miasm. So what is the chronic miasm? Chronic miasms are the fundamental cause of chronic diseases, and they produce the chronic diseases and predispose human being to acute diseases. There are three types of chronic miasms, that is psora, psychosis and syphilis. So after this we started with the first miasm, that is psora. So in this we see what is the meaning of psora, then what is mean by actually psora, then primary manifestation of psora, then latent psora and secondary manifestation of psora. So in this, the term or the dictionary meaning of psora is the itch or some similar skin disease or the each might. The derivation is Latin or Greek, and it is the original word being the sora, that is TOSORA, that is T is silent, which means a groove, a fault, a pollution, a stigma. And the biographer of Hahnemann also remarks that sora as an expression widely used general term for a whole series of skin troubles. So after this we study about the psora is the most important chronic miasm, which is the only real fundamental cause and producer of innumerable form of diseases. So it is the most ancient miasm which has gradually passed in some hundreds of generations through many millions of human organisms and had become the mother of all the thousands of varied diseases. So psora is the most ancient, most universal chronic miasm. During the last centuries, it has become the mother of thousands of incredible non-venereal chronic diseases. So psora leads to the non-venereal chronic diseases. So in this you must know venereal diseases and non-venereal diseases. Venereal diseases means diseases which are uh, contagious with or that are passes with a sexual way, and the non-venereal diseases in that these are not passes with a sexual way. So it is each dyscrasia leading to a functional disorder. Then after this we study about, that is the primary manifestation of psora. So in this, these are the different phases of psora. The primary manifestation of psora are the peculiar cutaneous eruptions, sometimes consisting of few vesicles accompanied by intolerable, voluptuous tickling, itching and a peculiar odor. So by in primary manifestation you will see the peculiar cutaneous eruptions that having a itching and peculiar odor. Then the latent sora, second phase comes, that is the latent sora, and in this, when the primary manifestation of sora are suppressed by local application, the local cutaneous symptoms disappear. But in this, the latent sora, it is suppressed by local applications and the local cutaneous eruptions, cutaneous symptoms disappeared, but the disease is driven inside or inward and may remain dormant, that is in the best cases and under the most favorable external circumstances. So in this state is called as the latent state of sora. When it is suppressed by some local applications, the local cutaneous symptoms gets disappeared and they driven inside the body and remain dormant in the body up till they get the exact stimulus. So this we call it as a latent state of sora. After the latent state of sora, the third phase comes, that is the secondary manifestation of sora. And in this we see when the person who has the sora slumbering with has exposed to some exciting or maintaining cause, the sora has awaken and breaks out as a several psoric chronic diseases. That is, when the latent sora has exposed to some exciting or maintaining causes, it shows its secondary manifestation in the form of chronic diseases, that is psoric chronic diseases. So this is the secondary manifestation of sora. That is, first there is the development of sora that gets suppressed by local means, then goes into the latent sora when exposed to some exciting cause or a maintaining cause, that shows the secondary manifestation of sora in the form of chronic diseases. So this is the journey of sora. So up till now this is the sora. Now we are going to start with the psychosis. Pra- this is we are going to take the what is the exact theme of that miasm and what are their phases. In every miasm, these phases you can see, that is primary manifestation and the secondary manifestation. But in the case of sora, you see the latent state of sora. So after the sora, we started with the second miasm, that is the psychosis. So in psychosis, you all know about that is psychosis leads to the overgrowth, and that is the extra growth of tissue, that we call it as a psychosis. So psychosis or the venereal fig wart disease is a venereal chronic miasm primarily manifested externally by the condylomatous and the cauliflower like growths on the genitals. So in this the sora, it is leads to the venereal chronic miasm. As we see, that is sora leads to the non-venereal chronic miasm, but the psychosis and syphilis, these are leads to the venereal chronic miasms and primarily manifested externally by the condylomatous and cauliflower like growths on genitals. So in this, when primarily they show their appearance as a condylomatous and the cauliflower like growth on the genitals, and this is the primary manifestation of psychosis. Then following improper coition, that is this happen after the improper coitions or improper sexual contact, when these excrescences are removed by the allopathic physician through some external means like cauterizing, burning and cutting or by ligatures. The figwort disease, after having been deprived of the local symptoms, would develop some other secondary elements, that is the secondary manifestation of psychosis, much worse than the before. So in psychosis you will see the two phases, that is primary phase and the secondary phase. So in this, mainly the what is the psychosis, it is psychosis also call it as a venereal figwort disease, that is, or it is a venereal chronic miasm. And in this you will see the primary manifestation of psychosis as the condylomatous and the cauliflower like external growths on genitals developed through improper coition are the primary manifestation of psychosis. So what you have to remember in psychosis, that is, it is a condylomatous and the cauliflower like growth. There is a overgrowth of tissue on the genitals that develop after the improper coitions, and these excrescences usually first manifest themselves on the genitals and appear usually, but but not always, attended with a sort of gonorrhea from the urethra several days or several weeks, even many weeks after the infections through the coitions. That is, it may be happen in after some days or after some weeks or after some months after the improper coition. So this is the overgrowth of tissues on the genitals, that is the condylomatous or the cauliflower like growth you see on the genitals after the improper coition, and this is the primary manifestation of psychosis, means primary look of the psychosis that you see as a primary manifestation of psychosis. And after this you will see the secondary manifestation of psychosis as when that primary manifestation of psychosis is removed by allopathic physician by different ways, that is cauterizing, burning or cutting or by ligatures. That is, if that growth is removed by different ways, after this will see, you will see the secondary manifestation of psychosis. So in this, when these excrescences are removed by allopathic physician in the most violent external way by cauterizing, by burning, by cutting or by ligatures, the figwort disease, after having been deprived of the local symptom, would appear in other and much more ways in a secondary elements. So after this they will show the secondary manifestation, and in secondary manifestation they can affect any organ or any tissue in the body, and they will show the psychotic chronic diseases on the body of a human being. So this is the secondary manifestation of psychosis. That is, primarily you see the overgrowth on the genitals, that is of condylomatous or a cauliflower like growth on genitals after the improper coitions, and after some days when these are removed by some external way, that will lead to the secondary manifestation of psychosis, and that is more dangerous than the primary manifestation, that as it can affect the any organ in the body. So this is the secondary manifestation of psychosis. After this we are going to discuss the, in this the genius of psychosis is produce redundant cell growth. It produces hydrogenoid constitution. This trait of stimulating or originating foci of proliferating cell is the substratum of those diseases characterized by extra aggregated cell or tissue growth. So in this, in psychosis you will see that is the overgrowth of tissue and the proliferation of cells, and in this it is characterized by the hydrogenoid constitution. So this is about the psychosis. So all of you understand what is the psychosis. In this only the what is mean by psychosis and primary and secondary manifestation of psychosis, this is explaining. And after studying the psoriasis, psychosis and syphilis, we are going to discuss the different comparative study of psoric symptom, psychotic symptom and syphilitic symptom. So this is the primary and secondary manifestation of psychosis. So after this we are going to start with the syphilis. So all of you understand about the psychosis or any difficulty regarding psychosis? Yes. Okay. So we will start with the syphilis. In this, syphilis is a venereal chronic miasm and primarily manifested outwardly by a venereal canker. What you see in a syphilis, that is the venereal canker. Syphilis also a venereal chronic miasm. Psychosis also a venereal chronic miasm, and SORA it is a non-venereal chronic miasm. So in syphilis it is a venereal chronic miasm and primarily manifested outwardly by venereal canker. So what is the canker? It is a painless genital ulcer, that is ulcer is formed on a genital organ, that ulcer is painless, that we call it as a canker, that is CHANCRE, that is canker, developed following an improper coition, and when it is occur, that is developed following after the improper coition. So in sorry and in sorry in psychosis and syphilis, you will see the cause of the creation of these miasms is the improper coitions. Then primary manifestation of syphilis, that is the primary manifestation of syphilis is the venereal canker developed after the improper coition. The canker appears after an improper coition, usually between the 7th and 14th day, rarely sooner or later, mostly on the member infected with the miasm. So it is appeared between the 7th to 14th day after the improper coition, and at first there appears a little pustule which changes into an impure ulcer with raised borders and stinging pains, and if it is not cured, it remains standing on the same place during man's lifetime, only increasing with the years. The secondary symptoms cannot break out as long as it exists. That is, it can remain for lifetime of a patient, that is the venereal canker. It may increase or sometimes it may remain as it is, but when it having some stimulus, that leads to the secondary manifestation. So in this, when the secondary manifestation occurs, that is when it is cured, or when the allopathic physician destroy these cankers. That is, if you cannot take the treatment for this canker, they heal by themselves or remain as it is for lifetime. But when you took some treatment for this or destroy this canker, then they show their secondary manifestation. So in primary manifestation, you have to remember that the primary manifestation of syphilis is the venereal canker developed after improper coition, and the canker appears after an improper coition, usually between the 7th to 14th day, rarely sooner or later, mostly on the member infected with the miasm. And at first there appears a little pustule, that is a, and that pustule can convert into a ulcer with raised border, and that we call it as a canker. And when it starts with a secondary manifestation, that is when the allopathic physician destroys this canker by means of corroding, cauterizing or dissecting substances, the canker is replaced by more painful substitute, the bubo. That is when you took some treatment, that is allopathic treatment, or when you destroy that canker by means of, that is cauterizing, dissecting substances, etc., that canker is replaced by a painful substitute, and that we call it as a bubo. Means that canker converts into the bubo of after this treatment, and which hastens onward to suppuration, and that leads to the suppuration of that genital organ. When are also they also drive out this bubo through their injurious treatment, then the nature develops more secondary elements through the outbreak of the whole chronic syphilis. And when you break also this bubo, that is a suppuration of that genital organs, that bubo is destroyed, then there is a more secondary elements you will see in a patient with, as a whole chronic syphilis is developed in that patient, and it destroys the tissues, organ and bones, and thus produces ulcerations, bone caries, etc. And when you destroy that bubo also, that converts into the chronic syphilis, and that leads to the destruction of tissues, organs or bones, and thus produces the ulcerations and bone caries, etc., in a human body, that leads to the whole chronic syphilis condition. So in secondary manifestation, when you remove that canker, it leads to the secondary manifestation. But if you cannot take any treatment for that canker, it can remain for lifetime of that patient as it is, as a canker. But when you remove that canker with different methods, that canker converts into the bubo, and when you also destroy that bubo, that leads to the condition of a chronic syphilis, and that chronic syphilis causes the destructions of all the tissue, organ of in the bones in the bodies, and that leads to the total chronic syphilitic condition. So this is regarding the syphilis. So this is the main theme of these miasms, that is SORA, psychosis and syphilis. In SORA mainly you will see the functional disorders or the diseases which are non-venereal in nature, and in SORA you will see the primary manifestation as a cutaneous skin eruption. Primarily you will see only the skin eruption in a patient, that having a itching or a burning, and that primary manifestation when treated with some local application, that converts into the latent sora, and this is a dormant state of sora that remain for long period, and when that latent sora exposed to some exciting or maintaining cause, that leads to the secondary manifestation of sora, and that leads to the chronic diseases, that leads to the sora or the soric chronic diseases. as a secondary manifestation. Then in psychosis, primarily you will see the overgrowth on genitals, that is, it is caused due to the improper coition, as it is a non-venereal chronic miasm. And on genitals you will see that is a condylomatous or cauliflower like growth after the improper coition. And when that overgrowth is removed by some external ways or some allopathic ways, that is cauterizing, cutting, after this, that secondary manifestation of psychosis is seen, and this will leads to the psychotic disorder, that is the proliferation of tissues and overgrowth of tissues and organs in the body, and chronic psychotic conditions. Then in syphilis you will see primary manifestation as a appearance of canker on genitals after improper coition, and when it is uh, destroyed by some external ways, that is cauterizing, corroding, dissecting. After this they converts into the painful substitute, that is the bubo, that having a separation of that particular genital organs. And when you also remove that bubo with external ways, that leads to the chronic syphilitic conditions that may causes the destructions in the tissues and organs and bones in the body, and that totally leads to the chronic syphilitic disorder. So this is the theme of these three miasms: psora, psychosis and syphilis. So all of you understand about this main theme of these miasms? Yes, yes, are you understanding? Okay, now we will see the comparative study of these symptoms of these three miasms, that is psora, psychosis and syphilis. As what we see in psora, what we see in psychosis and what we will see in syphilis. The comparative study between these three miasms of their symptoms, and these are important when we are dealing with a patient, as we know which symptoms leads to the psora, which leads to the psychosis and which leads to the syphilis. So in this, the comparative study of these chronic miasms, so in this the first is regarding the general point, that is the nature. So in this the general points, first point is nature of miasms, then second, tissue organs affected, then the third point, what diseases you will see in these miasms, then what is the psychic condition you will see in these miasms, then space of action, what is the space of action, what are the different desires and aversions, then what are the amelioration and aggravation. Then the second point that comes, that is the mind of these three miasms, then leading to head, eyes, ears, nose, mouth. So these are the different symptoms leading to different organs in the body, and what we will see in psoric, psychosis and syphilitic miasm. So in this the first point is general point, in this the first point is nature, what is the nature of psora, syphilis and psychosis. So in this the nature of psora, so in this psora are the products only functional disorders manifested by supersensitivity, itching, irritation, burning, leading up to congestion and inflammation. So what is the nature of psora? That you have the functional disorders that are manifested by the supersensitivity, itching, irritation, burning, leading to congestion and inflammation. That in psora you will mainly see the, that is functional disorders, and that having the itching, burning and inflammation. So the functional reactive symptoms you will see in psora, that is pain, itch, congestion, spasm and neurovegetative manifestation. These are the different pains that are functional pains that are related to the psora. So this is the nature of psora, that is the functional disorder. You have to remember this word, that is Sora leads to the functional disorders. Then what you see in psychosis? So in psychosis nature, they produces the incoordination everywhere, overproduction, growth, infiltration in form of warts, condylomata, tumors and fibrous tissue. So what you see in psychosis mainly, it is a incoordination everywhere and with overgrowth, overproduction and proliferation of tissues and infiltration in form of warts, condylomata and tumors that you will see in psychosis. So this is the main nature of psychosis. And then in syphilis what you see, that is it produces the destructive disorders everywhere, perversion, suppuration, ulceration, fissures, etc. So in this the main it leads to the destruction of tissues and organs in the body, and that leads to the, that is everywhere, perversions, suppuration, ulceration, fissure, etc. So this is the nature of these three miasms: Sora, psychosis and syphilis. Then the second point is regarding the tissue organ affected. In what are the different tissue and organs that are affected in every miasm? So in Sora you will see that is endodermal tissues that having action largely on a nervous system, endocrine system, blood vessels, liver and skin. In Sora mainly endodermal tissue is affected, that is action on a nervous tissue, then endocrine, blood, liver and skin. These are the main organs affected in Sora. Then in psychosis you will see the ectodermal tissue. So in Sora endodermal, in psychosis mainly ectodermal tissue, and in this the soft tissues that attacks internal organs, pelvis, sexual organs, blood, producing anemia. So this is regarding the ectodermal tissue, that is psychosis. And in syphilis you will see the mesodermal tissue, that is soft tissue, bone, glandular tissue, particularly the lymphatic etc. So this is the mesodermal tissue. So this is the tissue organ affected in these three miasms. Then the third is regarding the diseases. What diseases you will see in each miasm? So in this mainly the diseases, deficiency disorders that you will see in Sora, then deposition or overgrowth in the form of warts, tumor, fibrosis, etc. you will see in a psychosis, and destructive disorder you will see in a syphilis. So in this mainly Sora, excessive demand for supply of all natures, especially air, water, etc. but poor assimilation is there. So carbolism more active than anabolism. So in this the nutrition of whole organism is disturbed. Yes, can I audible?
Yes, ma'am.
Yes, ma'am.
So, okay, we are discussing the comparative symptoms of psoriasis, psychosis, and syphilis. So, in this, the first is regarding the general point. In this first point, we cover that is nature of psoriasis, psychosis, syphilis, then tissue affected, and the third point we are discussing about the disease. What diseases affected in which miasm? So, in this, you have to remember this thing, that is in sora you will see the deficiency disorder, then in psychosis you will see the deposition or overgrowth disorders, and in syphilis you will see that is the destructive disorders. Then after this, the next point is that is psychic. What is the psychic of each miasm? So in this, in sora you will see that is the richest in subjective manifestation, full of emotion, imagination, sensation, but a little or no objective symptoms. That is, psoric patients are mainly related to the richest in a subjective symptoms. These are the symptoms of their own. That is, subjective symptoms, or the that can be the symptoms which can be told by the patients only. So, this is the subjective manifestation, and they having the full of emotions, imagination, sensation, but little or no objective symptoms. That is, you cannot see the objective symptoms in them very or see them very rarely. Then in psychosis you will see that is not influenced by moral doctrines or religion, no spiritual outlook, insanity included to commit crime in combination with sora. That is, in psychotic patient you will see that is this patient having the psychic that is mainly related to, it is not influenced by any morals or religion, that is not influenced by any moral doctrines or religion, it they don't having any spiritual outlook, then insanity and included to commit the crime. This is related to psychosis. And in syphilis you will see that is has little subjective feelings, that is except pain, little supersensitiveness, less desire, craving and feeling. That is, there are mainly no feelings in these patients, that is in syphilis, that has little subjective feelings except pain, and little supersensitiveness, less desires, craving and feelings, that you will see in a syphilis. Then this is the psychic relation of these three miasms. Then after this, the pace of action. What is the space of action? That is, psoric patients are hyperactive, then psychotic patients are slow insidious manifestation, slow recovery of all the complaints. That is, slowness is main indication of psychosis, and you will see that is slow insidious manifestation, slow recovery of all the complaints. And in syphilis you will see that is the moderate space, overt in its manifestation. That is, sometime it may be the overactive, or at time it may cannot see or show any reaction. So this is regarding the syphilis. Now the next point of differentiation is desires and aversions. So what are the different desires and aversions in sora? So in craving is forerunner of an attack, a prodromal symptoms, craves sweets, then acid, sour, then fried things, averse to boiled food, craving for stimulants, tea, coffee, tobacco, besides hot food and meat. So these are the different desires and aversions of sora. That is, sora having the aversion of boiled food, then it having a craving for stimulants that require the tea, coffee, tobacco, and besides of hot food and meat, and having the uh, desires for sweets, sour things and fried things. Then in psychotic you will see that is craves for beer, which causes less aggravation and than wine, then meat arouses latent psychosis, likes either hot or a cold food, that is they can like either a hot or a cold food. And in syphilis you mainly see that is having the aversion to meat and prefers the cold food. Syphilis having the aversion for meat and prefers the cold food. So this is the regarding the desires and aversions of psora, psychosis and syphilis. Then after this the next general point is amelioration and aggravation. So in amelioration you will see that is the physiological eliminative processes, that is perspiration, urination, then menstruation complaints relieved by these natural eliminative processes are relieved by lying down, sleep, warmth, hot application in summer, then crying, eating, appearance of suppressed skin eruptions. These are the amelioration of psora. Then ameliorations of psychosis by an unusual elimination through mucus surfaces, that is leukorrhea, nasal discharges that causes the amelioration. Then physiological eliminations do not ameliorate. Then complaints relieved by slow moving or stretching, dryness, dry weather, lying on stomach or with pressure, then return of suppressed normal discharges, menses, that causes the amelioration in psychosis. And in syphilis you will see amelioration by through discharges of pus if old ulcer opens up, that is if there is a pus formation, that discharge causes amelioration. And complaints are relieved by from cooling. And in winter they are having the amelioration. And in aggravation in psora you will see that is between sunrise and sunset, by cold in winter, that causes the aggravation. And in psychosis you will see that is complaints aggravated by cold damp weather, resting and meat. And syphilis you will see aggravation by that is mainly sunset to sunrise, that is at night, is aggravation in summer by warmth of bed and from perspiration. So these are the aggravation and amelioration of each miasm, that is psora, psychosis and syphilis. Now the mental condition of each miasm, that is the second point. What is the mental condition of each miasm? In psora you will see that is the sensitive patient. These are very alert, quick, full of ideas, but no tendency to materialize them. A sterile philosopher can work for a short time, then profound prostration mentally and physically. Elements from fear, sorrow, full of anxiety, worry, lack of confidence and fear of darkness, being alone, restlessness of mind, dissatisfied with existing state, things, wealth, married life, etc. So these are the symptoms related to the psoric mind. Then what are the mind symptoms of psychosis? So in psychosis you will see the mental functions are uncoordinated. There is incoordination of memory, forgetfulness, absent minded, slowness of speech and reflection, cannot find words. Then incoordination in behavior, failing to speak truth, exceedingly suspicious, jealous, cross and irritable, cruel and secretive. The main thing is these people's having the incoordination of memory, and then there is a presence of forgetfulness, then absent minded, and in this you will see the suspicious nature. Along with this they failing to speak the truth, they are liars, that psychosis are the liars. Then they are having the jealous tendency, then cross and irritable, cruel and secretiveness, that they cannot open themselves very easily. As psoric patients told his or her symptoms very nicely, but the psychotic patient cannot told the symptom very nicely, as these are very secretive patients as psychosis mind. And in syphilitic mind you will see the mental sphere is not much invaded, mentally dull, stupid, stubborn, morose, fixed ideas, one cannot reason with them, then urge for destruction, suicidal tendencies, criminally insane, destroys precious things, then cold blood. Then these are the different symptoms of syphilis. That is, in this you mainly see that these are mentally dull and the stupid patients, having stubborn and morose, then they having fixed ideas in their mind, and one cannot have reason for them. How that having the fixed ideas, one cannot reason with them. Then they having the urge for destruction, that is, destruction is everywhere, in physical sphere also and in the mental sphere also. Then they having the suicidal tendencies, then criminally they are insane and destroy the precious things. So these are the different mental symptoms of syphilis. So psychosis, soric psychosis and syphilis. In sora, these are the very active, alert, quick and very emotional patients. Psychotic are the very, there is incoordination of memory, having forgetfulness, then secretiveness and suspiciousness are well marked in psychosis. And in syphilis there is destructiveness of mind is well marked. Then the next symptom is related to the head. So what do you see in head? That is, in head of sora, vertigo due to functional derangement of sensoria and hypersensitivity of all the sense organs. That is, the vertigo is due to the functional derangement in sora. Then in psychosis you will see the vertigo on closing the eyes. When the psychotic patient close the eyes, they having the vertigo. So vertigo is present in all the miasms, but you have to differentiate which type of vertigo is there. If there is a vertigo due to some functional derangement of sensorium or due to some hypersensitivity that causes the vertigo, this is the soric vertigo. And if it is caused due to closing of eyes, it is the psychotic vertigo. And if it is caused due to, that is, in syphilis you will see vertigo due to organic destruction of nerves, that links, nerve links, that is, it is due to the destruction of some nerves links, that is the vertigo of syphilis. Then in sora, headache usually temporal with bilious attack and nausea. Then in psychosis you will see headache on vertex frontal accompanied by sadness, coldness of body. That is, in sora you will see the headache as a temporal. In psychosis you will see the headache on the vertex and the frontal. And in syphilis you will see the headache start in night at back of the head and last for days. That is, the syphilitic headache is at the back of the head and it start at the night and it can be last for a days. So this is the differentiation of these symptoms. What you will see in sora, what you see in psychosis and what you see in syphilis. Then the headache symptoms worse between sunrise and sunset in sora. Then headache symptoms worse at midnight on lying down exertion in psychosis. And in syphilis you will see worse on exertion, warmth, rest, lying down and sleep. So this is the differentiation of headache. Then it is better by sleep and hot application in sora. It is better by motion in psychosis, and it is better by motion and cold application or a nosebleed in syphilis. So this is regarding the head symptoms, that is differentiation of vertigo and headache. Then the next symptom is eyes. In eyes, what you see in sora, that is a intolerant to daylight, oversensitive to light, itching, burning, spot before the eyes, that is spot before the eyes. These are the symptoms related to sora. Then in psychosis you will see thick copious pus formation or discharges. Then the gout of the eyes that you see in psychosis. And in syphilis you will see deformation of and ulceration of the lens, cornea, and intolerant artificial light, that is intolerable artificial light, you will see in syphilis. Then related to ears, nose, mouth, stomach, these are the different organs. They explain the differentiation of these symptoms, psoriasis, psychosis and syphilis. I think I will send you the notes of this differentiation of symptoms, so you understand how to do the comparison between these symptoms, psoriasis, psychotic and syphilis, of different symptoms. Yes.
Yes, ma'am.
Is it okay if I send the notes of this?
Okay, ma'am.
Okay, ma'am.
Yes, ma'am.
कारण ते असं कळणार नाहीये तुम्हाला, जेव्हा आपण डोळ्यासमोर बघतो ते डिफरन्सिएशन तेव्हा ते लक्षात येईल प्रॉपरली. फक्त याच्यामध्ये जे मेन पॉइंट होते ते घेतलेत आपण. येस.
Yes, ma'am.
तर अशा प्रकारे आपण फक्त इन शॉर्ट मायाझम घेतलाय. मायाझम किती पण डीपमध्ये घेतलं तरी कमीच पडतो. आता आपण फक्त त्याची समरी बघितली आहे, एक्झॅक्ट व्हॉट इज मीन बाय सोरा, सायकोसिस अँड सिफिलिस, अँड व्हॉट इज देअर प्रायमरी अँड सेकंडरी मॅनिफेस्टेशन, अँड द कंपॅरेटिव्ह स्टडी ऑफ these symptoms of psoriatic, psychotic and syphilitic. It is enough for second year for exam.
Yes, ma'am.
Okay, so what to take in next week?